Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A new nurse graduate indicates in charting entries that he is licensed registered nurse, although he has not yet received the results of the licensing exam. The graduate's action can result in a charge of a. Fraud, b. Tort, c. A malpractice, d. Negligence. The answer is option A. Fraud. 2. If the nurse notes the following symptoms after the client begins taking sertraline, which one is most likely drug-related? A. Drooling, b. Diplopia, c. Insomnia, d. Polyuria. The answer is option C. Insomnia. 3. A community health nurse is instructing a neighborhood class about botulism. The nurse teaches the group that the most likely mode of infection would be by direct contact with contaminated soil, b. direct contact with respiratory secretions, c. sexual intercourse, d. ingestion of contaminated food. The answer is option D. Ingestion of contaminated food. 4. During a visit to the prenatal clinic, a pregnant client at 32 weeks gestation has heartburn. The client needs further instruction when she says she must do what? A. Avoid highly seasoned foods. B. Avoid lying down right after eating. C. Eat small, frequent meals. D. Consumes liquids only between meals. The answer is option A. Avoid highly seasoned foods. 5. A patient who has a diagnosis of multiple sclerosis speaks slowly with long pauses between syllables. The patient is most likely in what stage of multiple sclerosis? A. Prodromal, b. early, c. middle, d. late. The answer is option D. late. 6. The nurse is ordered to administer ampicillin capsule TIDPO. The nurse should give the medication A. 3 times a day orally, b. 3 times a day after meals, c. 2 times a day by mouth, d. 2 times a day before meals. The answer is option A. 3 times a day orally. 7. The nurse is caring for hospitalized client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea. The nurse should take which immediate action? A. Administer oxygen to the client. B. Prepare to administer furosemide. C. Elevate the head of the client bed. D. Call the healthcare provider. The answer is option B. Prepare to administer furosemide. 8. A patient with long-standing diabetes mellitus is scheduled for surgical amputation of 4 gangrenous toes on the right foot. Which surgical intervention would this be classified as? A. Palliative, B. Curative, C. Reconstructive, D. Diagnostic. The answer is option A. Palliative. 38. A nurse is caring for a 3-year-old child with a fractured arm. Which of the following interventions is the most appropriate for pain management? A. Administer analgesics when necessary. B. Assess pain once a shift. C. Anticipate pain and intervene early. D. Encourage the use of self-quieting techniques. The answer is option A. Administer analgesics when necessary. 10. A female patient has been advised that laboratory tests confirm herpes simplex virus type 2. The nurse should teach the patient that a Papanicolaou test is recommended. When is the Papanicolaou test recommended? A. Every 6 months if symptoms persist despite treatment. B. Every year even if asymptomatic. C. Whenever symptoms recur. D. Every 3 years if other Pap smears have been negative. The answer is option B. Every year even if asymptomatic. 11. A nurse is caring for an 8-year-old male with cystic fibrosis. Based on the nurse's understanding of the disease, what nursing intervention should the nurse expect to perform? Restrict sodium and fluid intake. B. Give antidiarrheal medications. C. Discourage coughing after postural drainage. D. Administer pancreatic enzymes with each meal. The answer is option D. Administer pancreatic enzymes with each meal. 12. A hospitalized patient eats 20% of the meal and states being too tired to eat more. What should the nurse do? A. Offer to feed the patient after short rest period. B. Encourage the patient to finish the fluids. C. Remove the meal tray and allow the patient to rest. D. Encourage the patient to finish the protein portion of the meal. The answer is option A. Offer to feed the patient after short rest period. 13. A bricklayer has been diagnosed with multiple sclera. The nurse knows that construction workplaces have increased risk of aggravated symptoms because exposure to A. Dust, B. Sunlight, C. Heat, D. Heights. The answer is option A. Dust. 14. A patient with measles is on airborne precautions. Which of the following precautions techniques would be essential to implement for non-immune person entering the room? A. Gloves, B. Gowns, C. Face shields, D. Masks. The answer is option D. Masks. 15. An 82-year-old patient has Parkinson's disease. During the assessment, the nurse would expect which of the following actions to produce the most tremor activity of the hands? A. Eating with a fork. B. Resting hands in lap. C. Standing with hands loose at sides. D. Rolling a small pill between the fingers. The answer is option B. Resting hands in lap. 16. A postoperative patient complains of abdominal pain and nausea. The patient has not had any flatulence or bowel movement since surgery, and the abdomen is distended with no bowel sounds. What is the cause most likely? A. Abdominal infection. B. Side effect of being NPO. C. Side effect of narcotic pain medications. D. Paralytic ileus. The answer is option D, paralytic ileus. Which of the following is the most common site to obtain a capillary blood sample from neonates? A. Earlobe, B. Fingertip, C. Heel, D. Abdomen. The answer is option C, heel. 18. AIIMS healthcare nurse visits a patient diagnosed with rheumatoid arthritis. The nurse gathers information about the pain level after the use of the prescribed pain medication to check on the effectiveness of the intervention. What is this phase of the nursing process called? A. Assessment, B. Diagnosis, C. Implementation, D. Evaluation. The answer is option D, evaluation. 19. Which of the following is the proper position for a patient undergoing a cardiac surgery? Supine, B. Prone, C. Lateral, D. Fowler's. The answer is option A, supine. 20. A patient's wound is draining thick yellow material. The nurse correctly describes the drainage as which of the following? A. Serous, B. Purulent, C. Sanguineous, D. Serous sanguineous. The answer is option B, purulent. 21. A new nurse graduate indicates in charting entries that he is licensed registered nurse. Although he has not yet received the results of the licensing exam, the graduate's action can result in a charge of A. Fraud, B. Tort, C. Malpractice, D. Negligence. The answer is option A, fraud. 22. A woman is instructed to offer her breast to the baby for the first time within 30 minutes after delivery. What is the benefit of offering the breast for newborn early? A. Initiate the occurrence of milk letdown. B. Stimulate milk production by the mammary acini. C. Make sure that the baby is able to get the colostrums. D. Allow the mom to practice breastfeeding in the presence of the health worker. The answer is option B, stimulate milk production by the mammary acini. 23. The nurse is caring for a patient who has not had a bowel movement in the past 2 weeks and is suspected of having a fecal impaction. By performing what can the nurse confirm this? A. Digital rectal examination, B. Valsalva maneuver, C. Squat test, D. Hemoccult blood test. The answer is option A, digital rectal examination. 24. A patient is recently diagnosed with herpes zoster. The nurse establishing the care plan would most likely assign the highest priority to which of the following nursing diagnosis? A. Anxiety, B. Social isolation, C. Peripheral neurovascular dysfunction, D. Acute pain. The answer is option D, acute pain. 25. A 14-year-old boy fractured his right radius and a fiberglass cast was applied. 26 hours later, he returned to the emergency department with pain in the right lower arm. On examination, his fingers were cool and pale. Which nursing diagnosis is most appropriate? A. Impaired tissue perfusion, B. Risk for infection, C. Peripheral neurovascular dysfunction. D. Impaired skin integrity. The answer is option A, impaired tissue perfusion. 26. A patient with severe diverticulitis had surgery for placement of a colostomy. The patient is upset, crying, and will not look at the colostomy. Which of the following would be the highest priority nursing diagnosis at this time? A. A knowledge deficit, colostomy care. B. Distorted body image. C. Self-care deficit, toileting. D. Alteration in comfort. The answer is option B, distorted body image. 27. A 72-year-old male client has a total hip replacement for long-standing degenerative bone disease of the hip. When assessing this client postoperatively, the nurse considers that the most common complication of hip surgery is A. A pneumonia, B. Hemorrhage, C. Wound infection, D. Pulmonary embolism. The answer is option D. Pulmonary embolism. 28. Adiabetic patient with foot gangrene undergone above knee amputation. While the nurse changing the dressing, he complains of pain on the same knee which was amputated. What should the nurse do? A. Inform physician about it. B. Redo dressing to assessment the wound. C. Psychiatry consultation to the patient because he wound above knee. D. Give analgesic as needed. The answer is option D. Give analgesic as needed. 29. Which type of isolation category is indicated for patient with tuberculosis? A. Airborne isolation. B. Strict isolation. C. Reverse isolation. D. Contact isolation. The answer is option A, airborne isolation. 30. A child present to the emergency department with complaints of chest pain on exertion, shortness of breath, and dizziness. Upon examination, the nurse notes palpitations and a systolic ejection murmur at the right upper sterna border. Skin color is normal. What does the nurse suspect? A. Aortic stenosis. B. Patent ductus arteriosus. C. Tetralogy of Fallot. D. Tricuspid atresia. The answer is option D. Tricuspid atresia. 31. A public health nurse is developing a care plan for a low-income community in which there is a general low level of education and high level of crime. The nurse is using the nursing process to identify the community needs. Which step should be utilized? A. Diagnosis. B. Evaluation. C. Assessment. D. Intervention. The answer is option C, assessment. 32. A 30-year-old football player has a health problem which has been caused by the destruction of the posterior pituitary gland. The patient has increased urinary output and increased thirst. Which hormone had most likely been altered? A. Insulin. B. Vasopressin. C. Growth hormone. D. Follicle-stimulating hormone. The answer is option B, vasopressin. 33. 182. A nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? Right side, B. Low Fowlers, C. High Fowlers, D. Supine with the head flat. The answer is option C. High Fowlers. 34. During assessment, the patient elicited Hohmann's sign. What is the most important nursing action? A. Provide skin care. B. Secure patent airway. C. Encourage good venous circulation. D. Maintain fluid and electrolyte balance. The answer is option C. Encourage good venous circulation. 35. What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? High Fowlers, B. Raised 10 degrees, C. Raised 30 degrees, D. Supine position. The answer is option C. Raised 30 degrees.
Thank you for watching.